Yeah.
Guess you found it.
Yeah. Okay.
Do I have to look professional?
No, I don't think it matters. Um, I'm trying to pull up the questions. Okay, so first, let me pull up Google Docs and write.
Okay.
Okay, what is your job title?
Is he recording this?
Yeah.
Oh, so
Director of Managed Markets.
Okay, and then what's the name of the organization you work with?
Vital, Vital, Vital Care
Mhm.
Infusion Services.
Okay. Number of years you've been in the current leadership position?
6 months.
Uh, Number of direct reports, so like who works, like number of people that work under you.
None.
Okay, and then hopefully the Zoom works. Is there a way I can check like if it's working before it's like I just end it?
For the recording?
Yeah,
Um, no, it said it was recording.
yeah, I just want to make sure the audio and stuff works. Okay, well, we'll see. Um, okay, well, then the first question is what are the daily activities you would define as leadership slash managerial activities?
Um, from a national perspective, I lead contract negotiations with payers. I read and review contracts, negotiate rates, manage the team of credentialing specialists and doing the applications for payer contracts. I work with senior leadership to strategize on which payers we need, where we need them, what rates we're willing to take, and negotiate rates on the infusion drugs and the nursing services. Um, that's pretty much what I do on a day to day basis.
Okay,
I work with the claims team and helped facilitate getting payer claims issues resolved.
what are like claims teams do? Like what are claims?
The group of people that send bills, when you go to a provider's office and you are seen for um, like a cold and you get a shot and you get maybe some lab work done, those are the bill. That's the bill that goes to the payer, the managed care payer, like a United or an Aetna, to get paid, where we're asking to get payment.
Okay,
So the claims team will send those bills to the payers and wait for reimbursement. And then what's not reimbursed by the payer, we bill to the patient.
okay. What are the biggest challenges you face as a leader slash manager or like in your director role?
Um, Currently, it's negotiating pricing that's fair across all of the 38 states that we're in with the payers. There's significant um, sort of reductions in drug costs and or drug reimbursement, but yet the costs are still going up. So we're having to provide services with less profit and margin, and that's impacting locations' bottom line and ability to hire staff and see all the patients that they want to see.
Okay. What are the most significant rewards for you as a leader or manager? So like maybe getting whatever negotiation you need fulfilled, if that's one of them.
Right. I usually have several contracts that we sort of highlight or for sort of a strategy to work on the pricing. So when we are able to negotiate with the payer and get the pricing that we think is fair or more fair, that's an accomplishment. I would say the other accomplishment is when we've got franchise owners. Those are the people that decide they want to open a vital care infusion location across the country. When we get them up and running, when we've got everything that they need to get started to do business and see patients and start to provide care. It's a long process, can take up to a year. So in the last 6 months, I've been working with some owners to get their contracts in place and to make them understand how managed care works, so they can start seeing patients and start, making, the getting their locations up and running and making the money that they're supposed to be making.
Yeah. Um, 1 second. Um, okay. What are the greatest influencers of leadership slash managerial success in your organization? So, like, what key factors, people, or conditions have the biggest impact on how successful leaders are in your role in your job?
Probably just in general, thinking through all the types of different, leaders and CEOs I worked with is having people that are fair and understand the industry and understand what we're facing with reimbursement and government. We have a lot of what happens is based on how Medicare and Medicaid pay, which are government payers, and that really trickles down into the managed care side of it. And so if the leaders don't understand that those other government payers impact managed care payers, then it's a struggle to get them to understand why you can't negotiate the rates that they think you can.
Okay.
So it's always more beneficial when they understand the payer landscape more so than, not, because it's really hard to make them understand something as complicated as that.
Okay. How important, if at all, is for managers to be sensitive to employees' work-life issues slash needs?
Very, very important, especially in today's work environment. There's a lot of people that, there's a lot of different influences or influencers now to people's home life. And I think if you're not paying attention to what keeps employees happy and keeps them, keeps the work-life balance, you're not going to keep those people. It's too volatile. People can job hunt job hop way too easy now. And so it's important to make sure you're paying attention to what their needs are from a work-life balance and not just a compensation balance.
Okay. I guess because you don't have direct reports, this won't be a specific scenario, but what would you say is a general example of that? When you would what is something someone would be going through, and how do you think an organization your organization would handle that?
What do you mean, like childcare or something?
Yeah, or just
Or
anything you said at home stress, it's not just about compensation. It's work-life balance and stuff. What do you think is an issue people face that your organization would be able to handle?
well, in my current role, not having direct reports, kind of you still see those issues regardless with your peers or your team.
Yeah.
But I think organizations now are paying more attention to employees' mental health. and offering free like mental health services like the talk therapy. I can't think of the name of the other company, but Vital Care has it, Team Health had it, where if you were stressed and you just needed to talk to somebody, you could use this like hotline and call an outside vendor and get some like therapy
Hmm.
via telehealth, and it was typically free for employees. So
Okay.
I've seen that be a new thing that companies are doing that wouldn't have been anything anyone even would have thought of 15, 20 years ago, even though people probably needed it then. That wasn't a thing. And now that those types of services are offered and companies are providing it free, um, I know people use it, and I think that's one way that companies or leaders are paying attention to those types of issues.
Okay. And that kind of answers the next question, but how do you handle stress in the workplace? So like, what are the familiar sources of stress in the workplace for the employees and as a like director? So like what?
I think for the most part, most people just have a general sense of urgency, which gives you anxiety. Um, constant, you know, because everybody's reachable by phone, via text, via email, via instant message. Um, it creates sort of like a an environment where you have to provide an immediate response or be
Yeah.
on top of something at all times. And I think that that um, that kind of environment is what creates a more stressful situation, and trying to balance that and understand that, like, at least from my perspective and what I try to tell the people on my team is address things as they come in and sort of stay on, manage sort of manage your inbox, and don't let the noise of people texting you or calling you or instant messaging you in the middle of, tackling one thing. Kind of start from the bottom, work your way up. You'll get to it when you get to it. You can't manage five things at once, even though
Yeah.
that seems to be the expectation.
Um, so how would you describe your leadership managerial style? For example, employee oriented, task oriented, or a balance of both? So I guess like how do you handle your team, even if it's not like
Yeah,
direct report?
I don't micromanage. In the past, when I've had staff report to me, I pretty much set the expectations, and hope and, counsel them to do their work on their time at their pace. I don't typically set um, deadlines unless it's sort of an outside deadline, but we, I expect people to manage their own um, work and get it done. And if it takes 8 hours, you're sitting at your desk 8 hours. If it takes you 6 hours and you got time to do something else, right? There's a balance to that. You got to pay attention. If you got to run out for an appointment and you're
Yeah.
gone for an hour and a half, we'll make it up later. Don't, I think people can manage themselves. At least if you're in this kind of industry, you've got to be able to, um, yeah, manage yourself. I'm not going to micromanage you
Yeah.
and tell you have to do something by this time and stay on top of it. You got to manage your own work and make sure it's done.
What is the role of information in managing or leading any team or organization? So I guess like that can either be also this doesn't have to be your specific like the job you're doing now. It can be like a previous one, but that could mean like how information is relayed to you about a project or if like a negotiation is, you know, going one way, like how that information goes across to different from your company to the organization you're working with.
Say the question again.
What is the role of information in managing or leading any team or organization?
Yeah, I mean, it's in my world, it is all just, it's all information. It's information sharing. requests from the payers, contract negotiation, is back and forth via email or phone, or in person, meetings. If it's a bigger issue, we do a lot of financial analysis, so that's a lot of like database sharing and getting information from finance, getting information from the trade side of it, where they've got the cost or acquisition prices of drugs. It's probably every single piece of the company I have to touch, and the only way to do that is, information sharing, getting into databases, having them pull reports. Is that the kind of stuff you mean?
Yeah. Do you have like a specific team or or like part of your organization that like handles information that like sends you guys everything?
Yeah, we have, right, the normal like IT,
Yeah.
that's coordinating what programs and software we use, what apps we have, maintains the server for all that. But then we also have a team of business analysts who take data from the data, like data warehouse, which would be like the claims information I told you about, or the
Yeah.
cost of the drugs that we're using for the patients. And they go to all those sources and they use different databases and create like dashboards, and report, kind of like reporting, a reporting function with a dashboard, so you could go in and look at the data that they pulled together in different formats. So there's business analytics, there's IT, there's financial analysis, people that do financial analysis. So all those people are pulling data from different sources and
Okay.
then providing us opportunities to like go and pull reports from it or have them create reports or dashboards for us.
Okay. And then you already touched on this with the stress, but about the instant messaging and like how everything is very quick with technology, but what is the role of technology in managing or leading any team or organization?
The role of technology at
Yeah,
this
like how do
point
you
in
guys use it?
um I mean, pretty much every way possible we use it. Email, instant messaging. Um, I'm trying to think if there are there's other chat functions that we have within some of those dashboards I mentioned. Um,
Like
there's,
like most people that work with the organization like you work with are they what's it called remote?
yeah,
So then you guys pretty much use like Zoom and different
oh
calling
yeah,
for
all
I
of
mean
it.
like
Hmm.
everything.
Yeah, we use Teams, Microsoft Teams for ours. Yeah, and we have like kind of what they call Ring Central, which is what does our phone service. And when you get a voicemail, you get an email with the voicemail message. Um, and I don't have a phone. I just dial from my computer.
Yeah.
Um, yeah. So we use Teams. We use all kinds of different apps to communicate.
Okay. Um, what is the role of organizational policies and external factors in managing or leading any team or organization?
What is the role of policies?
Yeah.
Say it again.
What is the role of organizational policies and external factors in managing or leading any team or organization? I'll try to explain it better.
Okay.
How do internal rules, organizational policies, and outside influences, external factors affect the way managers and leaders run the organization? So like um, employee conduct policies, hiring,
Mm,
promotion rules, code of ethics, safety and compliance, and like
yeah.
does that make sense?
Yeah.
Like how do they shape how
Um,
you guys do things?
yeah, especially being a healthcare provider. Um, there's clinical guidelines, there's, like you said, workplace, that you've got an employee handbook and a mission, and just general guidelines you have in your sort of workplace. But being a healthcare provider and working with government payers, we have a lot of other external policies that we have to adhere to. Fraud, abuse, and waste is big with the government payers like Medicare. There's lots of compliance policies around that. Then there, clinical guidelines to patient care. Um, um, we have HIPAA compliance. So HIPAA is your healthcare information privacy. So if I'm working on a claim for a patient and I know certain things about that patient, I know where they live, I know their date of birth, I know their social security number, I'm um, I'm unable to share that with anyone outside the organization, or that's a violation of what they call HIPAA. So for a healthcare provider, there's a lot of external policies like that that impact how we work, as well as our own internal policies.
Okay. Um, do you think people can learn to be leaders, or some people born leaders? Why or why not?
Definitely think you can learn to be a leader. You're basically sort of learning by example, or taking leadership skills from various people that you've worked with, and you kind of develop your own way of being a leader. I definitely think it's a skill that can be learned. You go through leadership classes in undergrad and grad school, and a lot of what you're taught and you kind of understand about being a leader is proven out by those types of classes. You can really take those and put it you know, into practice when you're working and dealing with employees, or, external people like your payers and your clients, and understanding how to treat um, external um, external of the company, how to treat them as clients and provide good service, and you know develop good relationships. I think all that can be learned. I don't know that that's something you're born with. I mean,
Yeah.
it takes different experiences to develop
Um,
those skills.
what would you do differently as a leader slash manager in or for your organization? So maybe like doesn't have to be a specific, example, but maybe someone that you've worked under if you, like you said, micromanaging. Um, is there anything that you've been working under someone and they did something that you would like you found wasn't very efficient?
Well, in my last role, the person that was a direct report to me was not doing a kind of a critical part of his job, um, even though he said he was doing it, and he it appeared that he was doing it, but it was uncovered that he wasn't. And so probably the only thing I would have done different in that scenario would have been, um, I guess, to have set up an audit process that I didn't have, that I created after I realized he was not doing what he said for 6 or 7 months. And so I implemented an audit process on the backside, and that kind of a process probably would have been helpful to me to have done that from the beginning.
When you say like he wasn't doing something, was he like pawning it off to someone else, or is it just completely neglected?
Yeah, completely neglected. He was essentially to go into this system and um, input contract information and pricing and sort of set the contract up from a system perspective so that claims would pay correctly. And he was not doing that piece.
Yeah.
He was communicating the contracts out to different people, and he was assigning it sort of a contract ID, but then he never put the information in until it came up later from a claims problem perspective, where one of the claims managers came back and said, Pam, do we even have a contract with this payer? We're having all these issues. And I'm like, yeah, you have a contract. It would have been set up like last October. And they're like, no, it's not set up. But yet on his work log and the information he shared, he said it was set up.
Yeah.
He even told me what dates it was set up, and it was like a lie.
And then the last question is, what advice, tips, or guidance would you offer to individuals interested in becoming a leader or manager? So that doesn't have to be specifically your like organization or job field, just kind of like, someone who's getting ready to graduate. What do you think they should be doing or working on?
I would say that somebody that's starting with an organization's, right, you're not starting in a leadership role, but I would choose a leader within the organization and ask them like to mentor you.
Mhm.
They don't have to be your direct report, or you don't have to directly report to them. You just need to see them as somebody, after a while, you kind of understand who in an organization is sort of um, doing things well. And so I think if I were to do things over, I would have sort of sought out advice or help from more of a mentor perspective and asked somebody, just to sort of meet with me every couple months and talk about just different aspects of the company and where they think it's going and how I could, um, advance in the company or do things differently and sort of have somebody to model after. Um, I think that would have been valuable. It
Okay.
doesn't, it doesn't have to be somebody even in your same department, just somebody you
Yeah.
think has good advice or would spend time sort of like talking about bigger issues. Sort of what I would advise somebody newer to a company to do is kind of seek out somebody to have as a mentor.
Okay. Well, that's all I have. So
Okay.
thank you.
What are you doing with this information?